our resident expert, Wang, CEO of Optimity, joining us today. And I'm your host, Trista Chan. I have one of the best jobs in the world, which is to positively impact people's health and quality of life by working with organizations on implementing wellness strategies at Optimity. So we're very excited to have about 200 guests join us via webinar today. So welcome, and we're very glad to have you here. Optimity is a digital wellness platform that helps employees be successful at work through micro-habit training. It improves their quality of life at work and is used by organizational leaders to understand the pain points of their employees' health and to strategically target high-cost health issues to achieve ROI. It's a fully integrated solution with mobile apps, wearables, and an online portal, really saving you time and helping you execute your strategies in a very cost-effective way. So we have proven results in implementing wellness programs that really reduce drug claims, absenteeism, and leave to help achieve ROI between $1.50 and $6.50 for every single dollar spent on wellness. So our customers, they're able to run more initiatives, they're able to run them faster and easier, and to really effortlessly coordinate between multiple sites. So our cohesive wellness portal provides you with a database to drive your decisions on how to adapt your programs to get better outcomes. Our clients include PwC, Ontario Centres for Excellence, CST consultants, and with each one of them, we have dramatically changed the way they deliver wellness and report ROI. So today we have a very dynamic and info-packed hour. We'll be giving you the tools that you can bring right back to your organization. So I'll be introducing our CEO, Wang, to you shortly and handing over the floor to her, where she'll be sharing her knowledge on data-driven ROI calculations for wellness, lots of facts, and useful checklists to help you get your outcomes. She'll also be explaining how different types of ROIs are expected for different initiatives and really give you a 2017 checklist of cost containment strategies for management. Then I'll be sharing some of our digital wellness strategies and give you 4 tips on getting the best participation for your initiatives. So just some tips on getting the most out of this experience. Firstly, let's just take care of the sound. So connect to the audio using your computer's microphone and speakers, or you can select use telephone after joining the webinar to turn on the sound. All guest lines, of course, are muted just to avoid background noise and make this a smooth process for everyone. The slides in the webinar recording will be sent out to you to share with others. And finally, in the handout section, there will be a Willis Wellness Industry Trend Report and Optimity case studies available as bonus downloadable materials. And I'm Trista, very lovely to meet you. I am the advisor for corporate wellness strategies at Optimity. My background is in nutrition and health promotion for corporate programs. And my work at Optimity is mainly to help clients customize their programs and strategies to really target those high cost issues and drive home better outcomes. And I'm very happy to introduce Wang, the CEO of Optimity. So Jane has extensive background in global clinical trial management and preventive disease flagging, which has really become the backbone of the Optimity technology. She leads our analytics practice at Optimity and is responsible for supporting organizations in achieving ROI in wellness. So changing wellness from a nice-to-have to a need-to-have for organizations to control costs escalations related to health. I'm so happy to have her with us today and to share some of the best practices and lots of knowledge on what drives ROI for wellness.
Well, thanks for having me, Trista.
No problem. I'm ready to learn, so let's get started.
Sounds good. So it's really nice to wrap up the year and review results with everyone here. So on the webinar, we have clients, we have prospects, we have partners, all here, and I want to encourage you all to take lots of notes and to write to Trista and I if you have any questions at all. because we love talking about wellness and evangelizing on being more data-driven and more outcomes focused on this practice. Because more than ever, it matters to businesses in terms of dollars, top line and bottom line. And as you can see here, in 2016, HR is held more accountable for business results as ever. And 60% of organizations are holding HR accountable for not only gathering and driving recruitment, engagement, culture, but they're also looking at wellness as one of those practices. And I'm a huge proponent for strategically finding people who specialize in a particular practice. So the HR function, it's becoming way more strategic, and it's a real big cost containment strategy for organizations for success. When we look at wellness, it's really nice to talk about it because we're a specialist specifically in the wellness practice, and we're here to help organizations achieve results and look at a digital approach to this model. And in 2016, more companies than ever are going mobile first in the way that they're impacting people's lives. We're syncing more wearables. I'm sure lots of you are getting wearables for Christmas as well. Lots of personalized content delivery. We're expecting these technologies to come to us instead of us and going and seeking out the content. And we're looking for more holistic type of content, right? So this is everything from everyday health, staying active, to mental health, to mindfulness, to financial wellness, to safety, right? And we're even getting lots of requests for elderly care for people who are taking care of elderly parents or young ones at home. So it's really looking at balance of life holistically. And as we're collecting data through all these wearables, mobile, different types of strategies, wellness is becoming a more data-driven practice where it's getting the big data treatment. And C-level sponsors are looking at that and saying, hey, you have data. Now can you show me using your data some real results, some outcomes? If we look at the employee health costs, we know that this is costing employers over $1 trillion in North America every year. And the cost lost is both in the premiums, which is growing. The days absenteeism, we're almost hitting double digits. And in fact, with lots of our clients, we're seeing a reduction in absenteeism coming from 14 days down to 11 days, 12 days down to 11 days. So it's really, really nice to kind of bring that all together into more measurement. We're also seeing the increases in drug costs. From our clients, we're seeing anywhere between 7% to 20%. And that year over year, it's very easy to see how over 5 years, it could be more than double. And then, of course, unfortunately, when we look around, all of us are aging, and the whole population is aging in North America as well. So we are seeing these costs escalate. What's going up, right? So the first thing that's going up really is drug claims. Or we're seeing a lot of more strategic focus on outcomes by measuring these numbers. So if you look at your historical numbers for the last few years, you'll see that the number of claims going up is kind of dramatic. Over 70% of North Americans are at least on one prescription drug, and more than 50% more than on two. So we, in North America, 5% of the world's population is consuming more than 95% of the prescription drugs. And a lot of us are on everything from antidepressants to blood coagulants to sleeping aids, things that we can really avoid. So looking at those costs is very important. Other things such as benefits utilization, paramedical is going up a lot. People are really using up their benefits, which is great in a way, but at the same time, it's good to keep an eye on that because sometimes some of the practices are preventive, it will prevent other costs, but other times it's just additive costs and it could reflect on some of your culture. Sick leave, stress leave. So STD, LTD, this has been a big component of our research over the last 5 years. If you're looking at historical 5 years or over 5 years, you'll see that most companies have this double or 3 times what it was in the 90s. It's kind of outrunning all of us, and stress is a real issue. We can't just sweep it under the rug. We should really look at it as a mental health type of initiatives. So we work a lot with companies on stress-related absenteeism. Some companies don't track it. I think it's really important for you to track it to understand why people, especially on why people are calling in sick and not coming in. It has more to do with the way that you're working and the general culture of how your communication is set up. And then turnover. Many companies, especially with dispersed workforce, multiple sites, this distributed workforce has a lot of turnover issues due to culture, and this is continuing to escalate within North America. And then the last thing is that lots of fragmented wellness initiatives. We do hear, we help companies with really digitizing the centralized management and tracking of a lot of on-site programs. So this is everything from step challenge to having an on-site nurse to doing a health risk assessment to having yoga classes. And you'll see why sometimes these initiatives is really hard to track ROI, therefore there is no ROI. So spending money on wellness initiatives are supposed to help with all of the above, but are not. A little bit of theory about why things are the way they are. Most traditional wellness programs, so you'll see that yoga classes and gym membership reimbursements are adopted by the super fit, right? This is a concept that we call anti-selection within the insurance world. And the on-site nurses in the disease management is usually utilized by the super sick. So only Optimity focuses on this average in the middle, which is often forgotten. And this is where most of your prescription drugs, your benefits utilization, right, your paramedical, your absenteeism, those costs, the bulk of it is actually coming from the average. So it's super important to actually engage the average on their everyday practices. And that's exactly what we focus on. In 2016, we've been working on participation with all of our clients, and I'm happy to talk about how we achieved 74% participation for all across the clients. And we do this through really lots of micro little interactions. So I'm going to talk about the use case, what we had with PwC. They launched it with their audit teams. This is a group of millennials. And these people are really busy and they're working on clients, things that seem more important to them, but at the same time, you're seeing a lot of people who are sick, who are stressed out, and then turnover becomes an issue. So with them, we really worked on mindfulness. We worked on lots of connected challenges, a lot of things to do with culture, having team lunches, having announcements of just broadcasting what's out there for mental health to support them in their busy practices. And we're actually seeing a big change in terms of drugs, especially to do with antidepressants and also sleep aids. A lot of the ways that digital can help. A digital wellness platform can work through wearables, it can work through mobile apps. It helps you really integrate healthy micro activities into your everyday routines. This could be a backstretch right now, as you can do as you're listening to us. It could be slotted right in with your schedule. We sync with calendars. It can sync right between your client meetings, and you'll get points for doing these activities. It's incentivized. You can claim these for rewards. You know, a $20 movie card, it doesn't sound too bad right now during the season. And you can track all of your progress in one specific dashboard and compete with your colleagues, right? So this is really looking at it through holistic, going at micro, looking at social connectedness between everyone, gamifying the whole process, and bringing in incentives in a way that it actually works with you. It doesn't take you off your everyday path. And then for the admin side, for the company side, it's really about reducing a lot of the business costs in terms of operations, in terms of actually going in and taking the time to analyze the data and to see what's going on. So we work first with the claims insights, looking at historical claims, looking at what your biggest issues are, and based on the top 5 issues, then we can customize the digital initiatives, right? So with the admin panel, you can really customize not only just the look and feel of the consumer, of the user app, you can actually change a lot of the initiatives so that it becomes targeted, it becomes individualized, personalized, and the incentives management, of course, it's automated, so you're not actually going around giving people gift cards or going around cheering. That's great, but doing it through digital makes it available and accessible across all kinds of different sites, even when your employees are working from home. And then about the population, it's important to see the aggregated data together with analytics. So the data together with the so what's and on additional adaptation that you can make on your current wellness programs and measuring ROI, right? Bringing it all together and automatically calculating them. So when you look at ROI, a part of that cost, part of the hard cost actually comes from the amount of dollars and time that's saved from the HR department on centralizing and making it easier to manage. So I want to talk about another client of ours here. And with them, what we did is we did a lot of automated programming, right? They had a wellness calendar, different initiatives they want to run throughout the year. Pulling that all together, scheduling it in, it takes one day. We have a client success manager that helps you do that. And doing that right at the beginning makes it so much easier. So you're not taking 2-3 hours every week, which really adds up to quite a bit of time. Customization too, different sites, right? An office in Chicago, an office in Toronto, office in Philly, they want different things. They have different settings around them. Being able to offer them the localized programs from one centralized management system is also very important, saves you a lot of time as well. And then coordinating all that enthusiasm and all that peer-to-peer, there's a lot of virality that you can put into a digital wellness program that people have in their pockets. They can invite their friends. There's a lot of competition. So bringing that together and managing multiple sites with additional admins really changes the way that the amount of time, the amount of cost that you would usually take to do things. So if we bring it up a level and we look at how you look at the strategies for which companies are implementing these initiatives, of course you have all these added benefits of boosted engagement, more visible benefits, and reduced admin costs, and that's great. We talked about that a little bit already, but really looking at the hard dollars. How do you drive hard dollars? And that's why we're here today, to talk about ROI. So the first thing you need to do, and we help you do, is a baseline claims and cost analysis, right? So looking at historical, looking at what's been happening in the last 5 years to identify what the top issues are. The second is to look at reducing the specific drug or benefits cost of the unhealthy employees. So implementing targeted initiatives that is specifically and scientifically backed to help you change those numbers and tracking those numbers. Of course, the same system can also help you deliver targeted programs that are aimed at culture. So culture, if you have things that bring people into the office or help people connect to each other, then it changes absenteeism and turnover. So these are different metrics that you can measure, but these are what drives the ROI. So I'm going to share some very deep specifics about companies that we work with. This is a very large company that we have. It's 2,500 employees. They really looked at a 5-year investment into their wellness strategy. So I'll break this down. I know this is a little bit dense. We're going to go through it bullet by bullet, and I'm going to show you 2 other cases with mid-size employers and small employers. The first part, for the large employer, what they did is that they looked at a flex benefits plan. They looked at health reviews, and this includes on-site and also digital. They changed and they improved their chronic disease management program, their disability management program. They added incentives. Mental health was one of the biggest costs in terms of absenteeism for them, so they also added that in. They've included, in the last few years, an online wellness platform, and they changed their communication plan and executive dashboard. So the executive dashboard is really a dashboard that's kind of built specifically for this large company so that they can look at where their costs are changing, and they're bringing together actually 9 different vendors to do this specifically tailored to their company. And the savings that they're getting are both in hard savings and also soft savings. So the hard savings is really around how do you, the design costs of putting this all together, the admin, the operational costs, what it would run when they were all fragmented and all over the place, the change in the actual disability claims and duration, and then the last one that they saw is in drug and medical consumption. And the soft savings that they're getting is in absenteeism, turnover, cultural costs, and time and recruiting and productivity. So over 5 years, they are spending, they're budgeted for $3.2 million. They're about $2 million into that spending. And they have already realized $13.8 million. So this is a very, very positive ROI for them. And this is much actually above what they expected. And this is what happens when you have a team of 3 and you're able to internally pull together different vendors and work on that together. Not everyone gets that. So another way of looking at the strategy is look at how you can do this with digital. So this is a case with a mid-sized client that we have. They're 860 employees, and they went for a digital-first approach. So if you look at their investment, it's quite different from the first case. The investment is actually now made on a 2-year timeline instead of a 5-year timeline. They really looked at using a comprehensive online portal that manages their incentives, that we help them do their health risk assessment. It's a self-assessment instead of on-site assessment, has holistic health support, chronic disease management. So it pulls all those things together into a centralized database for them, a dashboard for them. And then they do lots of targeted cultural initiatives too. These are things that they came up with themselves and we help them implement. This is specifically aimed at reducing absenteeism because they have a high absenteeism number. This is in the public sector, so of course it's normal to see those numbers, and we work with them to understand exactly why that's happening with both their churn and leave and absenteeism. We helped them put together a very strong communications plan. So this actually started 3 months prior to their official launch of the program. It started with posters, email campaigns, bringing the wellness committee together, a group of 8 people, and really talking about what are the specific initiatives we want to launch and why. Communicating to them both by email and also through webinars to help understand why it is important to pull this all through. And then once it automatically starts with the digital program, then it just runs. But at least everyone's bought in, and it took about 3 months to do that. But the one nice thing for that is this is not coordinated within their HR department, because their HR department is actually not tasked with wellness. They have a wellness committee. We're doing a managed service for them where we're actually doing the communications plan with them. Everything's written, everything from posters to emails to the actual push notifications all comes from one place. The executive dashboard now is also done through both exported reports, but also online, so that they can always log in online and see in real time. And we're seeing basic check-ins every month for about 30 minutes with the executives within the HR departments to look at the specific numbers. And for them, the hard savings is a little bit different. So the order is different. It's still the same items. And if you look at your own numbers, you're going to see that you're looking at the same items as well, but some of the impacts are different between the organizations. So for this company, the biggest impact is actually in drug and medical benefits consumption. So that's what has really driven their ROI. They've got an incredible ROI for their 2-year investment. And in the soft savings too, their attrition numbers have changed. And this whole organization went from an average age of 49 to an average age of 46 during the time that we're with them as well. So a very different case. Good to think about how you can use technology to save a lot of admin time, but also to get that reporting. The third one that we can look at is a small client, and we have lots of companies, around 100 employees that we work with as well. So this is all managed digital. So all the things that the large companies do is all managed digital. For them, we manage every single thing in here. The hard savings is really in the design cost. We save them about 15K in terms of designing all this. It's all automatic. We do the managed service for them. It's very easy. And the disability claims and duration for them, they're tracking it, but there's not a huge number in here. But in their drug and medical consumption, they are seeing big numbers in terms of changes. So the soft savings in absenteeism, they're seeing a reduction of 2 days on average, which is quite big for that organization. And also in their productivity, they're tracking some of the other interesting productivity numbers, but that's not included in this specific calculation. So for them, for an investment of $15,000, they are actually getting 31K back within the span of a year, which is quite good. So the ROI for them is about 2.1. So for a case, I want to share another case with you where with a 8 months program, you can really, if you have really high adoption of your program, you can achieve a very high ROI. So this is a company that we've launched as CST, and they've done phenomenally in terms of adoption. They have 89% participation. They hit over 80% within the first month. They really used all the best practices that our team has given them. And this is a CEO supported program. The CEO talks about it. It's in part of their annual general meeting as well. And it's really great because they're seeing direct dollar savings in terms of drug claims. They're seeing direct changes in the attitude and also in the engagement score that they do in their annual survey. So that's changed dramatically for them as well. So within 8 months, they got $1.81 back, which is very, very phenomenal. So the Optimity promise for you is a ROI with every dollar that you spent. So this is a promise within year one, and how we really how we differentiate from most wellness programs, because it's really important for you to look at the data and see where all those numbers come from. If you don't have technology, we did spend a lot of time talking about technology. I do want to talk about what you can do on your own and just with a lot of practices. So we have a partner, Excellence Canada, and they have achieved a lot of really great results by putting in structures and putting in management strategies that help reduce all these numbers as well. So you can do this regardless of whether or not you have technology. It's just really want to evangelize the fact that wellness should be very data-driven and should give you lots of results. So let's go through a quick checklist of how you could get to ROI. The first thing that we should all work on is really gathering historical numbers. Looking at the data that you have in the last 5 years in terms of what you spent on drug claims, what's happening with your benefits utilization, what's happening with your absenteeism number, is your short-term, long-term disability going up? Why? Right? Why are these stress leaves going up? And when you look at that, you can get help from your benefits consultants as well, or we're happy to help as well. So if you reach out to us, we can help you identify your top 5 cost issues with your health. And then sit around with a team of people, with your wellness committee, with your HR team, with your executive team, and identify initiatives in your context that could address these issues. We work with safety companies, we work with consultants, we work with people who are out on the field. So it's very different what types of initiatives and what types of issues. You know your context best. So it's important for you to think practically and think about the initiatives that you could have, but that's okay. That's only a starting point, but it's good to know, at least seeded with a few things that's contextual to you. And then based on that, look at where you could end up, where you will end up. And just a rough back of the napkin calculation can help you estimate your ROI, right? That's a really good start. And plan for 2 years, plan for 5 years. The longer you plan, the more clear your strategy will be. With those ROI numbers, now you're armed, right? Now you're armed to go to your C-level exec, and you can get that support. And you can communicate to them clearly why there's a strong business case to making sure everyone is happy and their quality of life. Because the happy, fluffy story is really wonderful, but on top of that, there needs to be a strong business case about reducing costs. And in that, you can get the budget, right? You know exactly how much you could spend. You get the resource. Do you get it internally? Do you get it through managed service? So you can understand who is there to support you in what you need to do. And now you have that support. Now you can engage partners. And if you're large, you can engage 7 partners, 8 partners. And if you're small, you can engage a partner or 2 for the things that you specifically need help on. And we're here to help. And we can help you with targeted initiatives. We can help you with boosting all those ideas that you had and achieving that ROI. I can tell you exactly if you are able to hit that or even better than that. And then you can keep us honest as well with tracking results. So results should be tracked at least quarterly. You need to ensure that the engagement is there, right? That is not, you're not addressing just the edge cases as we talked about with the super fit and the chronically sick. You're really addressing the bulk of the average in the middle. You need to see engagement numbers above 50% for you to hit a bulk of those numbers and to hit your ROI. That's one of the most important things. If you have engagement less than 50%, it's very hard to get that ROI because you're probably serving more of your fringes than you're serving your middle. So yeah, so I'm going to pass back to you, Trista, and you can talk about some of the tips and tricks that you use with our team.
Okay, awesome. Thanks, Jane. So at Optimity, we work to support you with a gamified and fun solution for workplace wellness. We work with Fortune 100 companies to create good practices to improve employees' quality of life at work and also to drive down the risk for chronic health conditions. So when I work with clients, I do see the classic problems in modern employee success practices for the wellness managers. I'm just going to expand on those. So the first one is that there's multiple demands, both from leadership and from the employees. You know, there's lots of ideas, there's lots of great ideas, but it's really hard to prioritize between all these. Number two is that it's hard to coordinate. So there's a dispersed workforce, people are working more flex shifts, there's a bimodal age distribution with both millennials, there's mature baby boomers, and they all just have different preferences. So you really need to find a way that serves the different needs to keep wellness accessible to every single employee. There's also constantly changing requirements, such as a new need to provide mental health support and also a need for financial wellness education. There's an increasing high employee to HR ratio, so you're increasingly being asked to do much more with much less. And finally, there's demands on becoming more metrics driven. So I see clients, they're using more spreadsheets, when really what you need is a centralized dashboard and automatic smart analytics. So that's what we help you with at Optimity. So we basically make your life easier and keep your people healthier. So our Optimity digital platform works because it really helps bridge the gap between strategies and implementation so that you can really support your employees to adopt healthy activities while transforming organizations into a healthy workplace in a scalable and unified way, which drives behavior change. So let me just explain how the Optimity platform works and all the components it offers. So it has a customized mobile app that is available in 3 languages. It's accessible on any mobile device. It connects to 250 different wearables and apps, and we also provide the wearables as well. The centralized dashboard allows you to see real-time data and really help you easily implement all your holistic wellness practices. And finally, as we keep emphasizing, we have advanced analytics that really helps you retarget content to address those highest cost health issues that you're facing in your employees. So today I'm just going to share some of our secret sauce and some of our best practices to get you ROI. And engagement is often the first hurdle. So here are 4 tips that can really help you get more participation for your wellness initiatives. Our first tip on boosting engagement is that you can practice with or without technology is to go grassroots. So recruit champions across your organization, build leadership culture within the staff, and decentralize your efforts, but centralize the coordination and your results. So the Optimity system, it really allows you to recruit support, decentralize all your decisions, but centralize coordination results. It saves you hundreds of hours of admin work and just makes things much, much easier. My second tip is to go mobile. So everyone has a smartphone these days and people are continually working more flex time from home, they're working at different hours, just dispersed workforce, and they're just generally on the go, right? So by implementing a bring your own device model, you'll be able to help your employees get the right information at the right time and also really just move off of email notifications. So wellness emails, they're a thing of the past. They rarely get checked and they especially rarely get action upon. So a system like Optimity is helpful because it brings it to the mobile and wearable actionable items. and it really gives employees more health boosts and gives you more health data. Tip number 3 is to go mini. So big changes for health can really be achieved best through small nudges. We're all busy, so you must think small. Think about, the success of Twitter and their micro messages, and that going small will really boost the likelihood of the user taking action. So by going mini, you should aim to capture the attention, really boost the engagement, and know that the science of small steps is what leads to large impact. Optimity offers you hundreds of micro habits contents made specifically for this. And finally, my last tip is to go data-driven. So to be data-driven, you have to get your metrics, you have to get that expert support, and really improve and customize over time. You're already doing so much every day to drive the success of your organization, so it makes complete sense to take a strategic wellness view on wellness as well. So set those KPIs, consult with advisors like myself, because I'm very, very happy to help. It takes time to get really good at this, so see it as a process where you can use the tools and checklists and KPIs to really customize your offering over time. And Jane and I are very happy to support you on your journey and to also help you get started. So Jane, how about we do a quick recap for our guests today?
Sure. So I think we talked a lot about different ways and different strategies, and I hope I didn't overwhelm you with lots of information about how to calculate those ROIs, but we will be sending out a copy of the presentation, right, Trista?
Yes.
So you will be getting all the definitions and facts about the ROI calculations. You get to see the case examples that I ran through for the large, medium, and small size organizations. We talked about why it's important to get those numbers, and it helps you create the business case and to really make your life easier and more reportable on this. And the checklist we also shared on how to achieve ROI with this.
Awesome. And I shared how a digital holistic platform like Optimity can help HR managers to really engage and support their employees. I talked about digital solutions and best practices. I shared 4 tips on how holistic health can be scalable for you and how data can be your friend in supporting continuous improvement in your wellness practices. So thank you so much, everyone, for listening. If you want to learn more about ROI, definitely reach out to me at tchan@myoptimity.com. And just for a December promotion, we're offering a free historical claims assessment with Optimity, where we'll work with you to identify your top 5 health conditions and offer free recommendations to address them. So definitely, once again, feel free to reach out to me to book this service as well. And have a very healthy and happy day and happy holidays, everyone.